CEO Live Talks.
I am Dr. Swanee Jett, and I have a passion for public health for over 30 years. Now, I'm in a position to affect change, and these are the critical conversations about health in our community with the people who can help me make those changes. Good afternoon. Welcome to episode 2. I'm your host, Dr. Swanee Jett, and today I have a good friend with me, Mr. Vincent James. Welcome.
Thank you, Dr. Jett.
You know, one of the things, and I know you can appreciate this, you get a problem, right?
Mm-hmm.
That's the surface. If the problem reach your desk, it's 3 times worse
Yes.
than what it really is.
Yes.
So, and I
Yes.
saw that happen all the time.
All the time. That
Right.
that happens.
Right.
You know, it was really interesting. One of the things that a lot of folks, didn't realize and didn't know, but during my time with Metro government, I actually hired 5 African American PhD females in
Wow.
policymaking roles within city government.
Wow.
And the work that they laid out is still in action today in terms of what we see and the systems that were put in place. And that was really my forte, being able to identify talent and put them to work and let them do, turn them loose, let them do.
What policy did they do or did they create that actually changed the landscape in Louisville?
But all the things in dealing with homelessness and violence prevention, around that, and youth development, those were the areas in terms of what we did with youth development. Dr. Asha Brown and Dr. Billy Castle was leading that effort in terms of moving away from a youth development model to a social justice development model in terms of youth development. And the way that we cascaded that throughout the city, we began to build the foundation around grant offerings, having nonprofits working together because you couldn't apply for the grant individually.
They still have a little bit of trouble with that.
We had to work together
Right.
in order to get it. And so at least 3 nonprofits had to sign on together that they were going to solve a problem. And so we were able to take a little over $2 million and disperse it throughout those to those entities that we're serving. And but the foundation that she laid is still in existence today. The same thing with Dr. Monique Williams. She was leading the Office of Safe and Healthy Neighborhoods. I recruited her away from the University of Louisville. And so she built out the entire system that you see today as it related to utilizing, which you're familiar with, a public health framework and being able to look at the individual all the way out to addressing policies. And so we put together a system and looking at all of those different areas in which we had impact, we could have impact around violence prevention. And so that put us literally on the map during that time because that was still a lot of early work around violence prevention.
Because I remember some of the work from a committee, I think it was Dr. Blaine Hudson, led, and some of that was dealing
Dr. Nesbitt.
with Dr. Nesbitt before she left and went to D.C.
Right.
How much of that framework did Dr. Monique use in developing what she did?
Well, it was actually built from all of that.
Okay. All right.
That was the foundation. That's what we call the blueprint.
I was sort of looking at it, I'm like, I remember this because at that time, I think I was still around a little bit. I left in 2013.
Okay.
But I was on Kentucky Alliance Against Political Racist Repression at that time.
Right.
So I remember some of the things we were pushing for.
Right. Right.
But now I'm looking at, yes, we have. So I meant to reach out to her because I had an interesting idea. So there was so much violence happening. I had a public health model that, after a while, you become desensitized to violence. And I still believe in the construct that if I'm at war, if I'm so used to seeing blood or seeing violence or shooting at somebody, then I get used to seeing that. And I might replicate that.
Right.
So I believe in order to break that cycle, you probably need some psychologists or some mental health behavior going on to be on site to not only give grief counseling to the family, but everybody in the community that witnesses
Exactly. Exactly.
So, and I thought that would break the system of violence in the community.
Right. Yeah.
So that was my thought.
No, and your thought is you're dead on point. I mean, in terms of the way that you're looking at it, we actually did that. And in terms of, to give you an example of how that happened, I had a tragic, incident that occurred. Actually, two tragic incidents that occurred right around the corner from my church. The first one was actually in 2012. That's what started the Office for Safe and Healthy Neighborhoods, and the whole community coming together. There was a triple homicide. There, I was actually in my office and heard the gunshots, ran down the street, saw the two young men that had shot each other. And I knew both of them in programs that they were in the church when they was teenagers and when they was kids. And, they weren't teenagers, they was kids when they was coming to Vacation Bible School.
Right.
But I knew them, I knew their families. And so when I go down there, see this, I'd never seen anything like that in my life.
Right.
A young man laying on the ground with a hole in his head. Another was bleeding, profusely from his chest. And, I see this and the thing that came to my mind was, where did I fail?
Right.
Where did I fail these young men?
Right.
And so that's how I actually even got involved in violence prevention work, was from that one incident. That was a life-defining moment for me, because I went to volunteer for anybody and everybody that was doing anything with violence prevention.
From that incident, though, did you ever have any nightmares or dreams?
I was traumatized. Yeah, I had trauma.
Okay.
From that. I didn't know it at the time, but this was the 4th of July. This happened May 17th, 2012.
Okay.
Then July 4th, I'm sitting at home relaxing, and 9 o'clock rolls around, it's getting dark, fireworks go off, and all of a sudden, man, I'm having a panic attack.
Yeah.
I'm hearing this, and I'm like, what in the world is going on? I'm feeling like, now I didn't even know it was a panic attack. I thought I was having a heart attack.
Right.
And so
you get ready down now.
I'm ready down. I was like, listen, I got to go to the hospital.
Right.
This is hurting my chest. I can't breathe. And so I go to the hospital. He said, Mr. James, everything checks out. Probably most likely had an anxiety attack and a panic attack. And then I said, from what? I'm not, I don't have any anxiety, and that doesn't exist in my family.
Right.
And they said, well, it's happened to you. And they said you could do one of two things. You can go see someone and have talk therapy to see in terms of being able to help regulate whatever's happening, or you can get on medication. And I said, well, I'm doing the talk therapy.
Right,
I'm not doing the
medication.
medication. I didn't heard too much about it. And, and medication is fine. I'm not saying not to use medication, but for me, I said, if I can talk to somebody as opposed to taking a pill, that's the route I'm going.
Well, you need the tools. You
Exactly.
need the tools to make the change. And you got to try something before you try medication.
Exactly. And so, man, I tell everybody, I said, there's 3 people you need in your life. You need a coach, you need a mentor, and you need a therapist.
Yeah.
You need to have all 3 of them
do.
in your life. You need to
At one point or another.
At one point or another.
Speed dial.
Yes. And so, so that's what I did. I went to a therapist, talking with them about in terms of what had taken place, what had happened, helped me to realize that, that was a very traumatic experience that I had in seeing that incident, hearing the gunshots, and that was all just triggering everything else. And so was able to talk through that. And, 6 months later, I was, good as new, having that experience and knowing what I went through. Then now I'm helping other folks who are in the community who see this on a daily basis, at that time, especially during that time. And so I say that to say one of the things the second incident, we had a member who was walking out of the church, was murdered in the parking lot right across the street from the church building. And that was August the 26th, 2018. And I'll never forget it. And that at that moment, when I heard those gunshots, I'm like, man, what in the world is going on? This is right after church.
Right.
Like, who would be shooting on Sundays? Who does this?
Mm-hmm.
And I go outside and I see everybody gathering, over across the street in the parking lot. And I'm going over there. I'm like, oh my God, no. And man, and I saw, and he's a good friend too. And I saw him lying there, just, blood after the gunshot from the wounds. And I was like, this has to stop.
Right.
This has to stop. And so what we did was we called in therapists for the community. This was, the first time this was happening. And so, because I realized what I'd gone through in 2012.
Right.
And I said, if it helped me, and I know some people that have not had access to the help.
Right.
And so we wanted to provide that for the community. So we opened up our church. We had therapists to come in and open it up all week long for the community, where they could connect with therapists and they would be able to set up appointments or ongoing if they wanted to come to group.
Right.
They could do that, but it was a time for healing in the community and the church because
Right.
we needed it.
Right.
That was a beloved member that had just lost their life, and people had witnessed that, and so we wanted to make sure people were healing from it, and so
And was
that's
there
what we
any
did.
rationale as to why that occurred?
Yeah. I mean, his life used to be in the streets.
Okay. So
He
somebody
had
paid retaliation.
there was a retaliation after years of stuff that
Wow.
he had done. He had been out of prison for 11 years, and man, had given his life to Christ, was doing things and work in the community, and some old stuff came up, and unfortunately, he met his demise in terms of walking out the doors of the church. And he was always very open and public in terms about his life, his testimony, and his story.
Right.
And he always, I mean, he's led more people to Christ than I've seen, pastors and leaders in the church do.
Right.
And he said, I'm going to go as hard as I did for Christ as I did for the devil.
Wow.
And he did. He went hard.
Wow.
They say he was hard. He went hard in the paint.
Wow.
He was making it happen. And so it was a big loss to the community, to the church, and to me as a pastor, and because I'm supposed to be the protector
Right.
of the shepherd, the sheep,
Right.
as the shepherd. And so, again, it just caused me to really double down and focus more on terms of how can I serve folks.
Hello, I'm Dr. Swanee Jett. Please make sure you visit one of our 5 locations, not only in Louisville, but outside of Louisville and surrounding areas. Thank you.
Hello, my name is Sierra Clark, and I'm the Chronic Disease Manager at Park Duval Community Health Center. Ever since I started at Park Duval over 9 years ago, I have been committed to helping patients live healthier lifestyles. I am currently serving patients in the Chronic Care Management Program, or CCM program. My team and I help patients manage their chronic conditions such as obesity, high blood pressure, high cholesterol, and diabetes. In this CCM program, you will receive several benefits to help you manage your health. We offer monthly telephone calls to check in with your progress and to assist you with any concerns, assistance with scheduling your healthcare appointments, and assistance with filling your prescriptions in a timely and convenient manner. We also offer many resources to help you with the barriers you may face with eating healthy, being physically active, or monitoring your conditions at home. For more information, visit us online at pdchc.org or visit one of our health centers.
Hello, I'm Dr. Swanee Jett, CEO for Park Duval Community Health Centers. We conduct WIC, nutrition, and open enrollment for healthcare. So this is a one-stop shop facility for everybody in the community. The interesting thing, and I'm having a conversation with a few people about leadership, and about CEOs understanding who they are.
Right. Yes.
Who they are as a leader, but also as a person. So the one good thing of a true leader is you know your weaknesses and you know your strengths. How do you build your team around that?
Yes, it's a great question. I think, one of the things I've really been gifted to be able to identify talent. And I know myself, I know how I work. And I know the type of people that I need around me to help even accentuate those development areas that I may have or weaknesses that I may have. And so I really build a team around that. I know what I'm good at. I know what I'm strong at. And I know what I'm not. So I bring those folks that are better than me, that are smarter than me. If I'm the sharpest blade in the bunch, then I'm in the wrong bunch.
You're in the wrong bunch.
So I have no problems in terms of people. And as a matter of fact, I'm looking for people who are more qualified than myself, who have more experience than me, and surround myself with that kind of talent.
But that's a smart leader, because a lot of people that I've seen in the past are scared to do that.
Right.
Because they're scared to show that vulnerability.
Yes.
Or to think that they're not that smart. Like me, I always want people that have my blind side. I might not be good at this, but I'm real good at this. So let me do this.
Right.
I want you to do that, and then I don't micromanage.
No.
Right? I give you my intent, and I step out the way, because guess what? If I give you the details, then, man, you don't have no creativity.
Right.
Why do I have you?
Right.
So
Exactly.
let's go another step because you had 6 or 7 operations under you at the city.
Yes.
How did you manage that, first of all?
I can only say this truly. Only God,
Okay.
could give me the capacity and the ability to be able to
Right.
do that. And in doing this, utilizing the gifts and the skills that that I have and experiences that I had, it gave me an opportunity to be able to know how to lead large organizations. I
Right.
mean, my whole portfolio, I had 923 employees. I
It's a
had the
lot.
second largest budget in government. With the agencies that reported to me, it was over $123 million that I was
It's a
managing,
lot.
and it was every day. The city never sleeps.
No.
So I was working literally 7 days a week, all the
Oh,
time.
I believe you.
And
Public health alone,
yeah,
that budget was 32
oh
million. So
yes,
just
yes,
alone.
alone, right. And so what I was able to do again is identify the talent.
Mhm.
And so in those positions, they are appointed positions. And so I had an opportunity to really recruit some incredible individuals. But again, I recruited around what I knew I needed and
Mhm.
what the city needed. And so that's how I've always led in terms of being able to identify talented individuals, to bring them in, cast a vision,
Mhm.
and have them to believe and own it as though it was their own.
Right.
And then also, and as I go through the interviewing process, I look for clues as I'm talking with the person. Will they own this vision?
Okay.
And there's a strong indication as when I take a person through an interviewing
Right.
process, I want them to own it like it's theirs,
Right.
and so they begin to bring ideas and thoughts around that I haven't even begun to think about.
So they said they moved from I to this is what we're gonna do. Then
Yes,
they've
yes, they
transitioned right in the middle of the
transition.
interview. You're like,
Yes,
they already work for us.
yes,
How interesting. They said to make an offer.
right,
So
right.
what were some of the successes that came out of managing such a large operation?
And I think about when I arrived at the city, there were 2 people that was looking at homelessness.
Hmm.
When I came there, I was like, there's no way that 2 people are going to be responsible for the entire city for
Can't happen.
homelessness. And
Can't happen.
so I created a homeless division within the Office of Resilience and Community Services, and we went from 2 to 8.
Mhm.
And then I helped to create the system by which we were working with other nonprofits around homelessness, and they created the Homeless Coalition.
Mhm.
Now that was in a place before I arrived, and so what I was able to do is to build on that and bringing it in house within government.
Okay.
And so in doing that, we built a 4-phase approach for our chronically homeless. At any given time, it might be about 500 folks that are chronically homeless.
Right.
And so what I wanted to do was create a system by which we could take someone who was chronically homeless, who didn't even stay in shelters,
Right.
and take them from that place all the way to permanent housing. And so we have created this 4-phase approach from safe outdoor space, where we have Hope Village today. That's what that was actually set up to be. And then the rest of that was in terms of transitioning, having all the wraparound services at the Hope Village. In essence, the way it was to work, that they would leave there and go into temporary housing and then into permanent housing.
Did the tiny homes initiative ever? Because a lot of people want to move to tiny homes.
Yeah, yeah.
And I don't know. Did that ever come into play? Did you think that would
That
work?
was something that was talked about. It was discussed, but because we were actually even trying to identify with this safe outdoor space, we would use tiny homes. Like there was a model in Austin, Texas, that has a whole community, and so we decided to go with tents. And they was, heavily, industrial tents,
Right.
but it gave them opportunity to be able to be mobile and to provide those immediate services that was needed. And so that was the direction that we had taken.
So in Florida, I sat on the Homeless Coalition for Central Florida. So we covered 3 counties. And of course, 1/3 of the homeless live in Florida.
Yeah,
So we had
big population.
we had a huge problem. And so we looked to house them in old hotels that we renovated.
Right.
And that's the way we went about it. But I'm going to tell you what, I was shocked. I came to Louisville to visit, always come around Derby at that time, and 2020. I had never seen, I left 2013, came back once a month,
Yeah.
but for some reason, a light switch was turned on. and
Right.
then everybody became homeless, or a large population.
Right.
Why do you think? How did that occur? Like, I was
Yeah.
astonished.
I'll share with you what happened, and the numbers of homelessness has always been sort of consistent,
Okay.
in Louisville. But they're off on the periphery of society in
Right.
terms of in areas that are secluded that nobody would either bother or go to. Well, during 2020, which we had an anomaly of the pandemic,
Right.
and everybody was sheltering in place at home. And so all of a sudden you had all this free reign downtown
Okay.
where you could go anywhere. Nobody's going to bother you. Nobody's going to say anything. Police ain't going to bother you. And so you started having more and more of our houseless residents realizing that, hey, this could be a place we're next to food, we're close to the things we need. And so they moved away out of the fringes from the encampments to more into the city in terms of being able to. That's why you saw a huge
Yeah,
influx.
it's just an influx.
Yeah, they always, the homeless population in terms of the numbers has been consistent and around the same.
Okay.
But you didn't see,
Right.
because they was in secluded areas that you typically don't visit for various reasons. But
Right.
that's what we saw during 2020 and 2021,
Okay.
and why you saw the influx. And so that's why we actually created the whole system
Right.
of that 4-phased approach, because I just didn't want to just clean and clear the streets when you had these encampments that was happening. I want to be able to make sure that people had access to resources.
Tune in to CEO Live Talks with Dr. Swanee Jett every Saturday at noon on Wave 3. In this thought-provoking series, we bring you conversations with influential leaders, visionaries, and changemakers who are making a difference in their communities and beyond. Don't miss an episode. Mark your calendar for Saturdays at noon on Wave 3 to watch CEO Live Talks with Dr. Swanee Jett. Together, we can shape a brighter, healthier future for all.
Hello, everybody, and welcome to Park Duval. My name is Desmond Pritchard. I'm your Chief HR Officer here at Park Duval. I'm located normally 9 times out of 10 at the Wilson location. I'm beyond honored to support our community, to work with our community. There's a lot ahead of us. We have a lot we're ready to do, we're willing to do, and we can't wait to have you on board, to have you doing it with us.
So what's the 2 to 3 year goal? Because I know one of the strategies that I just noticed by observation is that you partner with a lot of different agencies and you sort of set up what I call mini hubs.
Yes.
I've seen that strategy.
Right.
What's some other strategies?
Well, that mini hub is really going to be an offspring for a lot of other things as well. One of the things we believe in, and one of the things I was very adamant about when I joined Dare to Care, is that the first thing we need to do with our neighbors who are experiencing food insecurity is provide a way that they can receive food with dignity.
Okay.
And so that comes with a client choice model where neighbors are not getting just a box, but they're having an opportunity to go in and select the types of food that they want.
Okay.
So we have some partners that are set up that way, and my goal and vision is that that's 100% of our partnerships, that they're set up that way for client choice.
And for the audience that might not know, because they might just think Dedicare supply canned goods, but I know you supply a lot more than that. So give us a breakdown on what can somebody expect?
Yeah, well, one of the things that they can expect in terms of Dare to Care is, if you think about all of the programs and out-of-school time programs that are in the city, and they have food, 90% of that food comes from Dare to Care.
Okay.
We provide meals. We have a kids cafe program, and the way we set up our programming is that we look at our food distribution. This is what we do. We distribute food in, food out. But there's gaps in between that we need to also fill for. And that's where we have our programs, like our Kids Cafe program that feeds kids out of school time during the summer. We'll prepare 19,000 meals a week during the summertime for kids to have breakfast, lunch, and dinner.
Now, do it go to camps?
It goes to camps. It goes to girls and boys clubs, community centers.
Okay.
Anything that's set up with out of school time programming, we're going to provide the food for them.
So is it easy to register a program to receive food?
Yes, it's through a federal program.
Okay.
And again, that's considered to be cut.
So if they do cut it, you said about 30%. Do you have a backup plan?
We're going to be at the whims of with everybody else, as it relates
Right.
to being able to get resources in to cover that. We can't make up what the federal government does. It's just
Okay.
impossible.
Because the scary part, a lot of people don't have jobs, so that might create homelessness. Then they don't have food, and then they don't have health care, which I have to provide some type of health care for them. So, you know, you have to be thinking as a pastor, are we pushing people to a brink to commit suicide or to create the greatest criminals?
Right. Yeah.
So what are we doing?
That question remains to be answered. I'm trying to figure it out. I think, listen, I was in, I went to Washington last week to D.C. and was on the Hill and talking with senators and
I
congressmen
was up
about
there
the,
2 weeks ago. No, 1 month ago. So
yeah,
I
same.
met with Congressman Garvey. So
Yes.
I know.
And so I was meeting with several congressmen and senators and talking about this bill that's coming up and why we need a farm bill and can't afford any cuts because this is the impact that it's going to have. So talking with them, about that. The one thing I can say, they were listening in terms of, they was listening respectfully. Whether they was retaining or going to do something with it, who knows?
Right.
Only time will tell. But the thing that I see is that, that has to be an ongoing, pressing need for the community to press these elected officials
Right.
into serving the people.
Okay.
And so the political, process in which we're going to need to engage in for now and the future is that the community is going to have to raise its voice and also be awakened to what's really happening.
Right.
I think people went to sleep, and for many other reasons in terms of things that's happened as to why we're here today.
Right.
But we're here. We can't change that, with nothing we can do, but we can change the future.
And one thing I would say, years ago in the 60s and 70s, we relied upon the black church, and the black church pastor always had the voice and was the leader of the community. Now, we have a lot more leaders that have stepped out. So it doesn't have to be just the church. And,
Right.
I'm glad, and I'm sure there's a lot of other leaders glad that you're here. And we want to collaborate. We want to continue to partner to do greater good because as money is stripped away, and I've seen it before, even in
Right.
government, us working collaboratively to get something done is the better choice for the community.
Oh, yes, by far.
By far.
By
So,
far.
I want to thank you for coming to the show. It's been a pleasure. I appreciate you tuning in to see your live talks. I'm your host, Dr. Swanee Jett. Thank you.